Yeah.
Okay. So in an actual case, a patient will come in with a healing cap on the implant. You'll see this little silver healing cap that prevents the gum tissue from growing around it, and hopefully it has done just that. If it hasn't, if the gum tissue has grown significantly over this, more than just a tiny bit, you're most likely going to need to get the doctor for him to anesthetize the patient. We may have to take a laser and trim that tissue back, because you're not going to be able to do what you need to do without, number one, hurting the patient, and number two, the tissue will get stuck around the parts as you're trying to put it in, and you won't get it seated right, and then it'll be just a big mess. Just like when we were seating crowns, remember our first rule is don't hurt the patient. So if they're apprehensive for any reason, even if it looks pretty much okay, we'll get them numb. But most of the time, if the tissue has stayed down low around this is one of the easiest and least painful procedures that you can do. Okay, so they'll come in with this healing cap. So you'll need to remove that. You can do this by hand. You can use the extender, which I like. You place it in there and unscrew it just like in your... Yeah, and let's talk about that. I have had a lot of assistants who are not comfortable with which direction that you turn things to tighten. That applies to nitrous oxide tanks and implants. Be certain that you know which direction is tighter and which direction is looser, because you will damage something in trying in an implant that could be very difficult to replace if you are tightening really hard when you think you're loosening. So go over to a sink and look at the direction that you turn to open up the water or to close it down. But the direction is taking your thumb and rotating it clockwise to tighten, or going to a counterclockwise to loosen. Now that gets a little confusing if you are working on an upper tooth. You got to pretend you've got your head turned and you're looking at the clock in that direction. So again, please be sure you know what direction you're turning. In any event, you're going to loosen this. If you cannot loosen it, if it's really on there tight, and you can't loosen it with your fingers or using this, you may have to use the torque wrench. Again, make sure this is firmly engaged in those hex things before you try to loosen things. The torque wrench is a device which is meant to break like that, to prevent you from over-tightening things. Let's pretend we're tightening. Now notice the direction that the torque wrench has the arrow in over here. If that's on the hex wrench and you are tightening in the direction that the arrow is pointing, you will get to a certain level of tightness and it will break. I'm going to hold this down because you need to keep it firmly in here or else it will slip out. There, it's broken. Stop tightening at that point. Repeat, stop tightening. That prevents it from being over-tightened. But if I continue to push, the torque wrench is no longer functioning and I can put an unlimited amount of pressure on that. So let's practice that again. Put it in the hex hole. Make sure it's securely in there. Keep it pressed down with your finger so it doesn't just slip out as you're doing it, and strip it. Put it in, it's secure, tighten. It stops turning and it starts to break and it breaks, so stop. When you've done that, that is 32 Newton centimeters, which is as tight as we want the final abutment screw to be tightened. Alright, that's tightening, but we were actually talking about loosening. So, placed with the same orientation so that you can see the arrow, you're going to turn it in the other direction if you can't do this by hand. So we're pushing it in and I'm backing it up, and now I've broken the tightness, and usually once you give that a little bit of a turn, you can unscrew it like that. Okay, so we're taking off the healing cap, again making sure it doesn't fall on the patient's, down the patient's throat. Set that aside, we may need it later. One thing with implants is that you got to assume that every little part and every little screw is critical and expensive, because pretty much everything that you touch with implants is going to be between $20 and $100, every little tiny part. So don't throw anything out. All right, so we've taken out our healing screw. There's no tissue around that that's going to bother the patient. Now we're going to put the abutment in the same orientation that we had seen before. Take cotton pliers and make sure it's seated down, pushing it down, and that there's no rotation. So I know the hex is engaged. You don't necessarily have to do that don't do it with that in place. All right, so it's down. The screw is in. Now I'm going to screw it down a bit, just finger tightness, checking to make sure it still feels like it's in the hex. Tighten it down, just finger tight. Don't torque it at this point. Now, to be sure that it's in the right orientation, try to put the crown on. There's a lot of things that could keep this crown from fully seating, like the contacts are not right, or there's a little bit of tissue in the way. But that's okay. As long as it looks basically correct and not, let's put this in the wrong orientation. All right, let's say you didn't have a clear buckle indicator there. So let's rotate this around. Okay, now if you're feeling that, you know that that's engaging the hex. It's not rotating around, so you think, hey, I'm doing pretty good here. Finger tight, looks great, it's secure. Now I'm going to try my crown on, and whoa, that's not going anywhere near the right thing. And you think, well, gee, maybe that's the contacts, but no. It's going to go a little bit better than that, even with tight contacts. So check your orientation again. If you're unsure, check it in the crown. Look for any buckle markings that you have there and make sure that they're right. So let's assume the orientation is correct. You've got your buckle lined up. Got a finger tightened. Okay, and you think that the crown is going to go on there fine. Let's take an x-ray at this point to verify that this is indeed seated, because before you start grinding on this crown, I want to make sure that this is really down. You can sometimes be deceived. You think it's down, but it's not. If you take an x-ray and you see a gap between the abutment and the implant, and show the doctor for sure, then you know it's not right. Go back, mess around with it, try to feel that positive seating in there, finger tighten it again, and then take a new x-ray. So let's say it is seated. So congratulations, you got the first step done. You've seated the abutment on the implant.